The charity fund in the sphere of social and cultural initiatives of Leila Adamyan presents Reproductive Tomorrow of Russia, the health of school children is our care. Good morning, dear friends and dear colleagues. We wish you a very happy holiday on the occasion of the Day of Knowledge. I believe that knowledge is power. It's the power of occupation, power of the family, power of the profession, power of the state. And I'm very happy that we have gathered in such a big and beautiful team here. This is an educational university which demonstrates the latest achievements in science and practice, mostly in the sphere of reproductive health. Those who weren't able to come here can watch us on the internet, and right in front of me there is a TV set, so I can see what we are saying, what we look like, and how great we are. The floor is given to Professor Vladimir Kuzmin. He is a well-known specialist in the sphere of infections in the reproductive system. He is the president of the International Association in the sphere of infections in the reproductive system, and you are provided the floor for at most 10 minutes. The presentation is titled Prophylaxis and Treatment of Inflammatory Illnesses in the Childhood and Adolescence as a Guarantee of the Future Health. The floor is yours. Thank you, Dr. Adamyan. Today, I would like to speak about the prophylaxis of inflammatory illnesses as a guarantee of the future health. What's important is that inflammatory illnesses affect the reproductive health of children and adolescents to a great degree. Every year in the world, there are more than 1 million people who are infected with sexually transmitted diseases. More than 500 million people live with infections, for example, genital herpes. But it's important to know that infections do not only affect the body directly, but they also increase the risk of development of other grave diseases, such as HIV and other very serious diseases. What infections can affect the reproduction and reproductive health of children and adolescents? Those are HIV infection, syphilis, tuberculosis, mumps, chlamydiosis, trichomoniasis, human papillomavirus, and I will speak about them today. What do the infections affect in children and adolescents? We should remember that infections in the adolescents might affect the fertility in the future. They may develop into chronic pains in the pelvis, result in miscarriages, incomplete pregnancy, premature delivery, disorders in the implantation, fetus development malformations, grave post-surgery complications, and even development and formation of oncological diseases. Today, there are unique and efficient methods of infection prophylaxis in children and adolescents, such as active immunization with vaccines against various infections, or passive immunization, or using specific immunoglobulin vaccines, which also are very effective in the treatment and, most importantly, in the prophylaxis. What are the physiological specifics of a vulva and vagina in children and adolescents? They are squamous epithelium covering the vagina and vulva, which is thin and having 5 to 8 layers. The cells of the squamous epithelium does not contain glycogens, and therefore there are no conditions for lactobacilli, and the environment in the vagina of girls and women is always alkaline. And this is the reason why it is a good environment for the abundant settlement of conditionally pathogenic microorganisms. The main physiologic protective mechanisms which block the ascending paths for infections in children and adolescents are epithelial atalaxia, various forms of phagocytosis, immune mechanisms of protection, lymphocytes, and immune globulins, which later create an acid environment in the vagina of girls which starts to function after 10 to 12 years of age, and the formation of this environment suppresses the pathogenic microflora. There are certain criteria for diagnostics of inflammatory diseases, such as minimal pain syndrome, that I have already mentioned, and other additional examination methods, or some typical specific symptoms, and other diagnostic methods. There is a very important problem that unfortunately up to 60% of symptoms are absent or are not diagnosed in clinics, and more than 60% of patients don't have clinical manifestations, so it is important to conduct laboratory and clinical diagnostics, which is a guarantee for success of the diagnostics and treatment of inflammatory illnesses. In the structure of wrong diagnosis determined in hospitals for young and adolescent girls, the lion's share is salpingo-ophoritis, or inflammation in parivariums, more than a half of all cases. There are various classifications of salpingo-ophoritis in children and adolescents, such as catarrhal and purulent, which result in grave complications and tubo-ovarian formations. Later, adhesions, purulent inflammations in the parivariums, and in the future they result in infertility. One of today's biggest problems is the HIV infection. It also affected children and adolescents. Just think about these numbers. More than 2 million adolescents in the world are infected today with the human immunodeficiency virus. More than 820,000 women and men at the age from 15 to 24 in countries with various income levels are infected with the HIV, and most importantly, in the whole world, the risk of HIV infection among children and adolescents, girls, is 2 times higher than the same risk among boys. So, of course, those risk factors, unprotected sex, presence of sexually transmitted infections, injections, drugs, various casual sexual contacts, are a great risk factor for the development of the HIV infection. Today we have very effective methods for combating, prevention, and most importantly treatment of the HIV infection, for example, antiretroviral therapy. Epidemic hepatitis, or mumps as it is called by people, it is a very serious disease. Just think about it. More than 50% of boys are diagnosed orchitis, which later results in infertility. What happens? It is an acute infectious disease affecting various glands, the central nervous system. It causes the replication of the epithelium in the mouth, in the blood, lymphatic system, and in the salivary glands. And most importantly, it causes inflammation in boys and girls, which of course results in very serious consequences such as infertility. Currently, we do not have any specific treatment for this disease. Therefore, the main prophylaxis method is vaccination, according to the vaccination schedule. Tuberculosis of sex organs. According to the WHO, in 2015, 1 million of children, just think about this big number, had tuberculosis. Of this number, 170,000 children died, and correspondingly, tuberculosis is diagnosed in adolescent girls in 7 to 15% of cases and causes grave consequences such as infertility. Also, tuberculosis affects ovaries, uterine tubes, vagina, vulva, uterus, causing highly expressed disorders, cohesions, obstructions, inflammatory processes, and of course, as a consequence of complications and inflammatory processes, it results in infertility. So prophylaxis and treatment, in particular with specific medicines, which are used to treat tuberculosis, are very important today. Urogenital candidiasis in adolescents and children is a disease caused by the Candida type yeast-like fungi. In most cases, Candida albicans is diagnosed in 80% of cases. But what's very important that I would like to emphasize is that detection of Candida fungi by the laboratory methods, if there are no clinical symptoms, it is not an indication for treatment. It is extremely important that there must be clinical symptoms and evidence that fungi are present, and only after that we can prescribe some specific therapy. It is very important to know that in 10 to 20% of cases, girls and women may be conditional carriers of this disease. But it should be remembered that candidiasis may also cause very serious complications, chronic inflammations, which also result in such a complication as infertility. Human papilloma virus in children and adolescents. There are various ways of infecting, such as vertical, from mother to a child, through a daily contact, self-infection with various manifestations. And here you can see a very good video how the human papilloma virus is implanted in the human body, and correspondingly how changes happen, which unfortunately in the future may result even in oncological diseases, such as cervical cancer. So, in this connection, it is very important to know how to combat these diseases, and the main method is prophylaxis. Because by using various prophylactic methods, we can prevent serious complications such as dysplasia, cervical cancer, ectopia, leukoplakia, and other grave complications. Currently, we identify three main oncogenic viral risks: high, medium, and low oncogenic risks. But the human papilloma virus, such as type 16 or 18, in more than 70% of cases, cause pathologies, cancer or precancerous diseases of the uterine neck. Today, an effective method of combating these pathologies is vaccination. There are various vaccines: bivalent, quadrivalent, or even nonavalent vaccines, which basically cover the major types of the human papilloma virus and can prevent the cancerogenesis up to 90% of cases. But it's very important to inject this vaccine before the start of the sexual life, and the optimal age is under 13 years old. Today, the WHO recommends applying a comprehensive approach in prophylaxis of the human papilloma virus. In the first place, it is a vaccination of children and adolescents under 13 years of age before the start of the sexual life, and, of course, education. Education which is also provided by our Open University. It is very important. Education about safe sex, recommendations to use condoms and other contraceptive methods, of course, combating smoking, drugs, obesity, etc. And the comprehensive approach will reduce the infection risks. At the end, I'd like to conclude. Effective examinations, sexual education, use of contraceptives, and later use of a screening program, and possibly use of treatment or prophylaxis, and introduction of a school medicine, and most importantly, multidisciplinary approach to the protection of health of children and adults will diminish the disease rates in Russia and the whole world. Thank you for your attention. So you can see what a well-trained presenter means. He said everything that was necessary. Thank you, Mr. Kuzmin. We really need you in our university. Thank you. See you at the next conferences of the Open University of Leila Adamyan.